The dreaded GERD is back with my pitcher here, Zach. He's got some excessive external rotation, some minimal internal rotation, but what we found is that his posterior inferior capsule is extensively tight, and what that's doing is that's pushing the head of the humerus in an anterior direction, and it's impinging and getting on top of these anterior structures here, and it's creating a problem. So our goal now is to hit a strengthening activity to target the posterior rotator cuff to hopefully pull the head of that humerus back. Alex is going to run through how we're going to do that.
Okay, so we have our patient seated on a Physioball. We have a towel between the arm and the body, and we have an elastic band tied to the door. So what the patient's going to do is he's going to externally rotate while lifting a foot, and I'll describe kind of what's going on as we do it. So we're strengthening the external, or by doing this, we're strengthening the external rotators, and we're also lifting the foot to make it seem like a more functional movement for pitching itself. I completely forgot what I was going to say.
It's okay. We'll keep going on this. This is good. Zach here, he's on one foot here. So basically the purpose of this is to increase trunk stabilization. He's having to activate his trunk more because he's on the stability ball. He's on an uneven surface. And we're lifting that leg because we're going to make it more functional and mimic what he does every day in practice, which is as a pitcher, he's going to be on one foot, externally rotating, loading that pitch up. So we're strengthening that posterior rotator cuff while he's in that single leg position.
Along with this, so this is a progression we'd be doing in a third stage of progress, I guess, with a patient like this. So we're really trying to add strength, improve dynamic stabilization of the shoulder, of the rotator cuff, and get some more neuromuscular re-education to those muscles and the motion of the arm. So there's other exercises we can do, but 3 sets, 10 reps, and then other progressions we can later move on to.